Hello everyone, hope you're doing well. Today I'll be talking about the axilla walls, axillary artery, and the surface markers of the axilla. As you can see here at the beginning, we can see that we have 6 walls or 6 borders, which is the apex, the base, the medial wall, the lateral wall, the anterior one, which is not visible here, which is represented by these black dashes, and the posterior wall, which is the red one. Let's see the contents of every one. We can start with the apex. As you can see here, in the anterior part here, we can see that it has the posterior surface of the clavicle, imagining that the clavicle should be here. Let's draw it like this. So we have the posterior part of the clavicle. In the posterior side, as you can see here, we have the scapula. So we have the upper border of the scapula, and medially we have the first rib. So we have the outer border of the first rib. This is the apex. Moving forward to the anterior side or the anterior wall, we have the pectoralis major, the beginning here, this one. Removing this pectoralis major out, we can find these two muscles, which is the pectoralis minor and the subclavius, this small one. Moreover, the clavipectoral fascia. The clavipectoral fascia divides, it occupies the space between pectoralis major and pectoralis minor. It should be here. Imagining that pectoralis major is there and it divides upwards. All done. Moving forward to the posterior side. In the posterior side, we have the subscapularis, this one, and the teres major and the latissimus dorsi. Those muscles occupy the posterior wall. Moving forward to the medial wall, which is made of serratus anterior only this muscle, which is here, as you can see, this one. And the lateral one is occupied by the biceps. Mentioned in the PowerPoint or in the lecture, we have the bicipital groove, this one. I don't know why, but it's mentioned there. As you can see here, this is the complete view of the axillary space or axilla. And it's so simple, as you can see, removing the pectoralis major, we can see it here, it's this space. If we're gonna move forward to the surface markers, we have the midline, like it's an imaginary lines. If you can stop in front of a mirror and remove or move your hands upwards 90 degrees, you can find that your body is imaginary lines divided into 3 parts, which is a mid one and anterior and the posterior ones. The anterior one is made by, or if you touch it or hold it, you can imagine it from here. You can find it's pectoralis major. The posterior one is made of latissimus dorsi and teres major. Teres major and latissimus dorsi. Because of that, we can find a posterior part. The mid one, it divides the body into anterior and posterior parts. Moving forward to the axillary artery, let's draw it. Let's imagine that this one is an artery or axillary artery. And something to mention that the axillary artery is divided into 3 parts. Part 1, Part 2, and Part 3. Part 1, it has only one branch, which is called the superior thoracic artery. Part 2, or the second part of the axillary artery, it has 2 branches. So the first one is thoracoacromial, and the second one is lateral thoracic artery. Lateral thoracic artery. The third part, it has 3 parts or three branches, which is the first one is the subscapular one. The second part is the anterior circumflex artery. And the third one is the posterior one. Like we have the anterior circumflex artery and the posterior circumflex artery. This part, or the axillary artery, is easy to remember. You know why? Because the first part, it has only one branch. The second part, it has two branches, and the third part, it has three branches. So mentioning that the name of the part, it gives a hint to the amount of branches that is in that part. Hope you benefit from this video. Thank you for watching.